You're listening to the Hoofcare Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Mark Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 8, Hoof Pastern, Axis.
Introduction.
The Hoof Pastern axis, HPA, is a foundational concept in hoof anatomy, farriery and equine biomechanics. It describes the alignment relationship between the dorsal surface of the hoof wall and the dorsal surface of the pastern, encompassing the proximal phalanx, P1, middle phalanx, P2 and distal phalanx, P3. When viewed laterally, the ideal hoof pastern axis presents as a straight, continuous line from the dorsal pastern to the toe of the hoof. This alignment is not merely an aesthetic ideal, it reflects a balance of skeletal orientation, soft tissue tension and load distribution through the limb. Deviations from a normal hoof pastern axis alter how forces are transmitted through bones, joints, tendons, ligaments and the hoof capsule itself, with significant implications for soundness, performance and long-term limb health. The concept of the hoof pastern axis has evolved alongside advances in veterinary science and farriery. Historically, farriers relied primarily on external landmarks and visual appraisal to assess alignment, often guided by tradition and empirical experience. While these methods remain valuable, modern understanding has highlighted the complexity underlying apparent hoof angles. The external hoof capsule may not accurately reflect internal skeletal alignment, particularly in horses with chronic hoof distortion, previous pathology or long-standing imbalance. As a result, the hoof pastern axis must be understood as both an external visual guide and an internal anatomical relationship. Understanding the hoof pastern axis requires an appreciation of both static conformation and dynamic function. While a horse may appear to have a certain axis when standing square on a level surface, the true mechanical consequences are revealed during movement when the limb is subjected to cyclical loading, acceleration, deceleration and uneven terrain. The interaction between limb conformation, trimming, shoeing, footing and workload all influence how the axis functions over time. Farriery interventions that seek to influence the hoof pastern axis must therefore be grounded in anatomy, physiology and a realistic understanding of how much change can be safely achieved.
The normal hoof pastern axis.
A normal hoof pastern axis is traditionally defined as a straight line when the dorsal surface of the pastern and the dorsal hoof wall are viewed from the side. In this configuration, the angles of P1, P2 and P3 are harmoniously aligned, allowing compressive and tensile forces to be distributed evenly through the limb. The joints of the distal limb are positioned to function within their optimal ranges of motion, reducing abnormal stress on articular cartilage, subchondral bone and periarticular soft tissues. In the normally aligned limb, the coffin joint, pastern joint and fetlock joint share load in a coordinated manner. During weight bearing, the fetlock descends, the pastern joints flex slightly and the hoof capsule deforms to dissipate concussion. The digital cushion and the lateral cartilages expand, while the hoof, wall, bars, sole and frog act together as a functional unit. A normal hoof pastern axis supports this integrated mechanism, ensuring that no single structure is overloaded at the expense of others. From a biomechanical perspective, a normal hoof pastern axis facilitates efficient energy transfer during locomotion. As the hoof lands, ground reaction forces are absorbed and redirected up the limb along the skeletal column. During mid-stance, the limb supports the weight of the horse with minimal rotational torque at the joints. At breakover, the alignment allows the deep digital flexor tendon and superficial digital flexor tendon to function within their physiological ranges, while the navicular apparatus experiences controlled, evenly distributed loading. In farriery, maintaining or restoring a normal hoof pastern axis is often a central objective. This involves managing toe length, heel height, and the orientation of the solar plane so that the hoof capsule supports the natural alignment of the limb. Importantly, a normal axis does not imply that all horses should share identical hoof angles. Individual conformation, breed characteristics, and limb proportions influence what is normal for a given horse. A thoroughbred with long sloping pasterns may have a markedly different hoof angle from a native pony with short upright pasterns, yet both may exhibit a straight hoof pastern axis relative to their own anatomy. Radiographic assessment has become an invaluable tool in confirming a normal hoof pastern axis. Later medial radiographs allow evaluation of the alignment of P3 relative to the hoof capsule, as well as the relationship between the phalanges and the ground. This is particularly important in cases where flares, long toes, crushed heels, or capsule migration obscure true alignment. When the axis is normal, the dorsal hoof wall is generally parallel to the dorsal surface of P3, and the pastern bones align smoothly above it without abrupt angular changes.
Functional significance of a normal axis.
The functional significance of a normal hoof pastern axis extends beyond static alignment. It has direct implications for stride length, limb flight arc, and overall movement efficiency. Horses with a well-maintained normal axis often demonstrate fluid, economical gaits with consistent foot placement and symmetrical loading patterns. This efficiency reduces fatigue and supports sustained athletic performance across a range of disciplines. Tendons and ligaments of the distal limb are particularly sensitive to changes in alignment. In a normal axis, these structures operate close to their optimal elastic limits, storing and releasing energy with minimal microtrauma. This is especially important for the superficial and deep digital flexor tendons, which act as dynamic stabilizers during stance and propulsion. The suspensory apparatus similarly benefits from balance loading, reducing the risk of cumulative strain. From a pathological standpoint, a normal hoof pastern axis is associated with a lower incidence of many common distal limb disorders. While no alignment guarantees freedom from injury, maintaining normal relationships reduces excessive focal stress on joints, tendons, and ligaments. Consequently, achieving and preserving a normal axis is widely regarded as both a preventative and performance-enhancing goal in farriery and hoof care.
The broken back hoof pastern axis.
A broken back hoof pastern axis occurs when the dorsal hoof wall angle is lower than the angle of the pastern, resulting in a backward deviation of the alignment line when viewed laterally. In practical terms, the hoof appears to be laid back relative to the pastern. This configuration is commonly associated with long toes, low or underrun heels, and delayed breakover, and it is frequently encountered in both shod and unshod horses. Anatomically, a broken back axis alters the orientation of the distal phalanx within the hoof capsule. The palmar angle of P3 may be reduced to 0 or become negative, shifting load toward the palmar structures of the foot. As the deep digital flexor tendon passes over the navicular bone, tension within the tendon increases, resulting in elevated compressive forces on the navicular apparatus. Over time, this altered loading environment can contribute to structural and degenerative changes. The broken back axis is often compounded by hoof capsule distortion. As the toe migrates forward and the heels collapse, the dorsal hoof wall no longer reflects the true orientation of P3. This disconnect between internal anatomy and external appearance can mislead visual assessment and lead to inappropriate trimming decisions if radiographic information is not considered. The longer the imbalance persists, the more entrenched the distortion becomes.
Clinical and performance implications of a broken back axis.
The clinical implications of a broken back hoof pastern axis are wide-ranging. Horses with this alignment frequently show signs of heel pain and discomfort within the caudal foot. These signs may include shortened stride length, reluctance to land heel first, toe first landings, and increased sensitivity on hard or uneven surfaces. In performance horses, subtle gait changes may precede overt lameness. The increased strain placed on the deep digital flexor tendon and navicular region predisposes affected horses to conditions such as navicular syndrome, DDFT lesions, and navicular bursitis. The coffin joint may also be subjected to abnormal stresses, particularly during breakover, increasing the risk of degenerative joint changes. At the level of the fetlock, the broken back axis can contribute to excessive hyperextension, placing additional load on the suspensory ligament and distal sesamoidean ligaments. From a farriery standpoint, addressing a broken back axis requires careful incremental correction. Reducing excessive toe length, improving heel support, and facilitating earlier breakover are common objectives. However, rapid or aggressive changes risk overloading structures that have adapted to the existing alignment. Successful management often involves a collaborative approach between farrier and veterinarian, guided by radiographic monitoring and regular reassessment.
The broken forward hoof pastern axis.
A broken forward hoof pastern axis is characterised by a dorsal hoof wall angle that is steeper than the angle of the pastern, producing a forward deviation when viewed laterally. In this configuration, the hoof appears more upright in relation to the pastern. Broken forward axes are commonly observed in horses with upright feet, high heels, or clubfoot tendencies, and may be influenced by genetics, growth patterns, or previous injury. Anatomically, the broken forward axis increases the angle of the distal phalanx relative to the ground, often resulting in an increased palmar angle. While this may reduce tensile strain on the deep digital flexor tendon, it alters joint loading patterns. The dorsal aspect of the coffin joint experiences increased compressive forces, and the pastern joints may function closer to the limits of extension during stance. The hoof capsule in a broken forward axis often displays limited deformation under load. The digital cushion and lateral cartilages may be underutilized, reducing the hoof's capacity for shock absorption. As a result, concussion forces are transmitted more directly up the limb, which can have implications for joints and soft tissues proximal to the foot.
Clinical and performance implications of a broken forward axis.
Horses with a broken forward hoof pastern axis often demonstrate a distinct movement pattern. The stride may appear short and choppy, with rapid breakover and limited heel expansion. While such horses may perform adequately in certain disciplines, the reduced shock absorption associated with this alignment can increase cumulative stress on joints and bones. Clinically, a broken forward axis is associated with conditions such as dorsal coffin joint arthritis, high ring bone, and increased wear or cracking of the dorsal hoof wall. The concentration of forces on the dorsal aspect of the foot may also contribute to sole bruising and reduce comfort on firm ground. Over time, repetitive concussion may predispose these horses to lameness higher up the limb. Farriery intervention in cases of broken forward alignment must be approached with caution. Excessive lowering of the heels in an attempt to create a straighter visual axis can increase strain on the deep digital flexor tendon and navicular structures, particularly in horses with inherent upright conformation. Instead, the emphasis is often placed on optimizing load distribution, maintaining adequate heel support, and promoting functional balance rather than forcing conformity to an idealized alignment.
Balancing conformation, function, and intervention.
One of the central challenges in managing the hoof pastern axis lies in distinguishing between conformational variation and pathological imbalance. Not all deviations from a straight axis are inherently harmful, particularly if the horse remains sound, comfortable, and capable of performing its intended work. Farriers and veterinarians must therefore evaluate alignment within the broader context of the individual horse. Factors such as age, breed, discipline, footing, and workload all influence how the hoof pastern axis functions over time. A young horse in growth may exhibit transient deviations that resolve with appropriate management, while an older horse may have long-standing adaptations that should not be aggressively altered. Dynamic assessment, including observation of the horse in motion, provides critical insight into how alignment affects function. Radiographic evaluation is an essential component of informed decision-making. By visualising the relationship between the hoof capsule, distal phalanx and pastern bones, practitioners can differentiate between cosmetic imbalance and true skeletal misalignment. This information supports targeted, evidence-based farriery strategies that prioritise long-term soundness.
Long-term consequences of hoof pastern axis imbalance.
Chronic imbalance of the hoof pastern axis, whether broken back or broken forward, can have cumulative effects on the musculoskeletal system. Abnormal loading patterns accelerate wear of articular cartilage, increase stress on tendons and ligaments, and compromise the shock-absorbing capacity of the hoof. Over months or years, these changes may manifest as degenerative joint disease, chronic soft tissue injury, or recurrent lameness. In younger horses, inappropriate management of the hoof pastern axis can influence skeletal development and joint orientation. Early, informed intervention can help guide healthy limb development and reduce the risk of permanent conformational defects. Conversely, poorly considered corrections may introduce new stresses and long-term consequences.
Conclusion.
The hoof pastern axis represents a critical intersection between anatomy, biomechanics, and farriery practice. A normal axis supports efficient movement, balanced force distribution, and long-term limb health, while broken back and broken forward alignments introduce distinct biomechanical challenges and potential pathologies. Understanding these relationships allows farriers and veterinarians to make informed decisions that respect both form and function. Effective management of the hoof pastern axis requires a holistic, horse-centered approach that integrates anatomical knowledge, careful observation, radiographic assessment, and thoughtful intervention. Rather than pursuing a rigid visual ideal, the goal should be to optimize function within the context of each horse's unique conformation and use. When approached in this way, the hoof pastern axis becomes not simply a line on the side of a hoof, but a dynamic indicator of equine health, performance and welfare. Thank you for listening to the Hoofcare Companion. Please follow, rate and share this podcast on your social media to help the Hoofcare Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.